Why do other healthcare practitioners keep insisting on changing the doses that I discharge patients on? Look at this. I received this from a follower, and she was on progesterone, 100 milligrams orally. Went back to her family doctor, said, listen, I'm having some reflux. I've heard I can use it vaginally, so I'd like to try that. And the doctor just randomly was like, well, I've never heard of that, so I'm just going to give it to you every other night instead of every night. So typically what happens is patients come to me because their family doctor, their nurse practitioner, their primary care provider said, I don't know how to help you, or I don't believe in hormones, or it's just perimenopause, you're not in menopause, there's nothing we can do, or try an antidepressant, I'm not giving you hormones. So they come to a specialist like myself who thoughtfully, carefully, and with nuance creates a regimen that is working for them, and then discharges them to the family doctor, who suddenly is the expert and arbitrarily overrides the prescription that I sent them back on. Now, to put this in context, I am a family doctor. Over the years, I've had hundreds of patients come back to me from a specialist on a regimen that maybe I wasn't as familiar with. But guess what? I didn't change it. I trusted the expertise of that specialist. You can't go from, I don't know anything about this, to, I'm going to override this. Make this make sense. It happens all the time. I see it all the time. It is mind-boggling to me. I really don't understand this. I am really struggling to find an answer here. And before you ask, why don't I just keep prescribing and seeing this patient for all eternity? That's not the way specialty medicine works, and I'll tell you why. There are a finite number of hours in a day and a week. My job is to see patients and to establish a regimen for them that is going to work for them. If I have to continue following thousands and thousands of patients forever, I can't keep taking new referrals and helping women. So the way specialty practice works is you see the patient over X amount of time, and then the idea is hopefully then you discharge them to their primary care provider to continue with that treatment. Menopause care is not unique in this. This is almost every specialty field out there.